Thanks very much, everybody. Welcome back to Dungannon. It's a little brighter today. Today we've had a sobering assessment of the current phase of the pandemic from our Health Minister, Robin Swan, based on the latest medical and scientific evidence. And we all know that what we're battling against and that it has been moving swiftly across the community during this winter wave. Our hard work together and individually over this last 4 weeks has pushed the R rate for cases down to well below 1, now between 0.65 and 0.85. So by our collective efforts, we have halved the rate of cases in a fortnight, and day by day we are reducing that further, and we've done so right across Northern Ireland. So that shows that our efforts are having a real effect. So by close of play yesterday, 166,538 vaccines had been delivered, including 144,212 first doses. For the Phase 1 high priority cohort to be concluded by the end of this month, 83% have been vaccinated so far. And it's anticipated that all over 80-year-olds will have been offered a vaccine by the end of this week, and we will be commencing the over 75s group next week. Each week, the Executive considers data on mobility, and we can see that there has been a significant reduction in the number of people travelling, and this reflects a personal decision by so many of you to do as we asked you to do, and that was to stay at home. And for that, we really do thank you, because you are saving lives. Again, I want to commend all those who are helping make this possible, to the employers and managers who are supporting staff to work at home, to all of the supermarkets, food stores and pharmacies who are running efficient delivery services, and of course to our teachers and lecturers who are supporting the education of our young people off school and off campus. We have made progress, but our war and battle against COVID is not yet won, and our hospital case numbers remain at extremely high levels. So we're asking for that support to keep going. To not press forward would risk all of the hard-won gains. So we need to keep pressing forward to provide our National Health Service with the full relief and the respite it needs from COVID. This week, the NHS is facing the peak of COVID demand, and the system is truly struggling to cope, and that's been recognised by the request for military assistance. We've seen that in the pressures on our ICU beds, the pressure on our general hospital beds, and of course the human burden on our staff. We know from back in the autumn that these numbers will only decrease very gradually, and that this will be the situation for the coming weeks. So we're asking our NHS to keep on going, and as a broader community, in order to support them to do that, so must we. The Executive today has reviewed the current restrictions and agreed that they remain an appropriate and necessary response to the serious and imminent threat posed by COVID-19. And following a detailed outline from Health highlighting the continuing pressures on our hospitals and ICU departments and the emergence of the highly transmissible variants, the Executive has agreed that the current restrictions will be extended for a further 4 weeks until the 5th of March 2021. The restrictions will be reviewed on or before the 18th of February. Now, I appreciate that this will be disappointing to many people listening to us this evening. I think particularly of those who are feeling the pain of separation from loved family members and friends, for workers and employers who are worried about their livelihoods, and indeed parents who are juggling the education of their children with work and other responsibilities. Separate arrangements have been in place for our schools outside of these regulations, and the Executive will have a comprehensive discussion next week around schools returning and, of course, the broader education issues. This is undoubtedly the most difficult of times, and we know the sacrifice that you're all making to save lives. And as an Executive, we are committed to taking every possible step to move us forward out of this pandemic. We have invested in the development of a robust and effective vaccination programme and in a highly efficient contact tracing service which has a 24-hour turnaround in 93% of cases. And both of those services, the vaccination and the contact tracing, are the envy of other jurisdictions. Our UK four-nation partnership has delivered medical support for our hospitals from our armed forces, a national vaccination programme that is world-leading, unprecedented funding which has proved invaluable across all facets of our society, and the establishment of genomic testing, which will be crucial to the fight back in relation to the new variants. At present, we estimate that the UK is undertaking 40% of all genomic global sequencing. So we're pushing ahead with our work on a pathway to recovery. The COVID-19 task force are going to bring recommendations on the approach to a relaxation of restrictions to coincide with our review in February. But in the meantime, we're asking people to keep going, to follow the public health advice, stay at home as much as possible, and remember, if we all work together and we do it, we will get through it. Michelle.
Thanks, Arlene, and good afternoon to everyone, and welcome back again to the Hill of the O'Neill. As always, I want to start by sending our sympathies to the 21 families that have lost a loved one as a result of COVID-19. The situation with the epidemic at present is a very difficult one. We certainly have made some progress in driving down the transmission rates, but they are decreasing slowly. We have sustained the R rate below 1, which is the Executive's objective, and we think it's somewhere between 0.65 and 0.85 at this moment in time. And this is very welcome evidence that the current restrictions are having a really positive impact. And again, I want to thank everyone for all that you have done to protect yourselves, protect your family, protect your community and protect the health service. However, it will take some time for the restrictions to have maximum impact on the course of the epidemic. And the consequences of the very high number of cases over recent weeks is still making its way through our hospitals, where the health service situation at this moment in time is extremely challenging. In fact, I believe the health service is facing into its toughest week yet throughout the course of the pandemic. COVID-19 hospital occupancy is still extremely high and will remain high for many weeks. There are currently 806 COVID patients, inpatients, and 70 of those people are being cared for in our intensive care units. This sustained pressure on our hospitals has a serious impact on the capacity within the health service to provide care and treatment for all other patients also. So it's crucial that the Health Department, in conjunction with the health trusts, do all that can be done in order to ensure full resumption of services as soon as is possible. It's in that context that the Executive has today reviewed the health protection regulations, and we have agreed that the current restrictions need to remain, that they're absolutely necessary at this point in time. And based on the advice of our health professionals, we have also taken the difficult decision to extend those restrictions by 4 weeks until the 5th of March, and we will review that position on the 18th of February. We know that many people will be worried about what that means for them, for their families, businesses and livelihoods. We also know how challenging this is for everybody, and we also know that we're asking a lot of everybody. But we will do everything that we can to make sure that you're supported during this time. The Finance Minister, Conor Murphy, has today announced further funding to support businesses and other sectors, including education, tourism and transport, including an additional £100 million for the Localised Restrictions Support Scheme, which has already helped more than 11,000 businesses, support for the tourism industry, a further £20 million for the Company Directors Scheme, £7.5 million to meet the challenges of education through COVID, including support for childcare. And in addition to this funding, Conor Murphy has also asked that all ministers urgently bring forward proposals to support businesses and individuals through these restrictions, particularly those who have not yet received financial assistance. In terms of schools, we know that families and teachers and support staff will rightly be concerned about what the evolving situation with restrictions means for the return to learning. We need to have certainty with regard to schools as soon as possible, and we discussed this at the Executive today. And the Education Minister has indicated that he will give further urgent consideration to this in consultation with the Department of Health, and will bring a paper to the Executive next week. We know that many people would have expected this news today in terms of the restrictions. However, we also know that it's been a long and a hard road for all. There is no doubt that there are better days ahead, but we need to keep working together right now to save lives and protect the health service. The message very much remains today to stay at home. Please only leave the house when it's absolutely necessary. When you do go out, keep your distance, wash your hands well and often. And if you have symptoms or have been identified as a close contact, you need to self-isolate. And when the vaccine is offered to you, please take it up. To finish today, I want to say thank you to all those who work across health and social care. We cannot overstate the scale of the work our healthcare workers have undertaken and the magnitude of the pressure that they are under. But they have kept going. They've kept going to care for their patients, to care for our families, to care for the sickest and the most vulnerable in society. So just like they have kept going, we also should too. So please stay at home. Thank you.
Ministers, as you say, most people were expecting this announcement today, but the CMO has said in the past that he believes that restrictions he keeps mentioning Easter. So would it not be better to say to people now, given the fact that we're hearing that the health service is going to be many, many weeks before it's able to recover from this peak that it's in or coming to just tell people now and be honest, the likelihood is you're going to be here until Easter?
Well, first of all, Tracy, I think it's important to look at the legislation under which we make these restrictions, and that absolutely says to us that we have to be proportionate and we have to only do what is necessary. And that's why we always build in review dates. And whilst we have announced today that these restrictions are rolling over until the 5th of March, we will review that on the 18th of February, because it would be very wrong to keep restrictions in place for any longer than is absolutely necessary. We came to that decision today when we looked at the evidence that was brought to us from the Health Minister and decided that we needed to put these in place for another 4 weeks. I know many people across Northern Ireland will be very disappointed about that. A lot of them won't be surprised, however, when they look across the United Kingdom and see what's happening, and they will know the pressure for themselves in our own hospitals. So I don't think it will have come as a huge surprise, but it is our duty as public representatives, as people asking the community to take these restrictions seriously and abide by them, that our part of the bargain is that we will only keep them in place for as long as is strictly necessary.
So we discussed this out today, and I mean, throughout the whole of the pandemic, you can't always be certain, but you can give clarity. So our attempt today is to say to people, OK, there's a further 4-week restriction in place, but to be very honest with the public, we don't know what will come after that. I think we have to be fair, but we did discuss as an executive today the fact that there may well need to be further restrictions, but it will depend on what we all do now. It will depend on how we can get the virus under control. It will depend on the new variants that are obviously occurring and the impact that that has, particularly the fact that they're more transmissible, so they're spreading at a faster rate. So all those things have to be part of our consideration, but our commitment to the public is not to keep things in place for any longer than necessary. So what we're trying to do today is to give that, even in advance of the end of this current period of 6-week restriction, to say there's an additional 4 weeks and there may well be something after that, but it's within our control in terms of our own behaviours around what we do in the next number of weeks to try and prevent that being the case.
And on the issue of schools, I appreciate that the Education Minister has to bring a paper next week, but in all likelihood, would you expect to see school closures continuing in line with the overall restrictions?
Well, I think it's important we do hear from the Education Minister. As you know, special schools continue to operate, and indeed for people who are key workers, they can also avail of school as well for their children. We need to review all of that. We also very much need to review what is coming down the line in relation to exam qualifications, and hopefully there will be clarity in relation to how people are going to award qualifications over the next couple of weeks as well. So this is an ongoing issue. I think it's fair to say that those of us who are homeschooling at the moment are looking forward to the day when our children can return to school. Not least for them, of course, because the best way to be taught is in school. But we all will take into consideration where the public health is at any point in time, and therefore the Education Minister and the Health Minister will be meeting over the next couple of days to look at that. Of course, schools are in remote learning now until mid-term, and so there is clarity on that for parents, and of course we will want to give clarity to parents and schools in a timely fashion, because that's very important too.
I don't really think there's an awful lot to add to that, apart from to say that parents and the teaching staff deserve that clarity as quickly as possible. So I'm glad that over the next number of days both health and education will meet, and then I hope that at some stage, the early part of next week, that there can be clarity given to parents.
To go back over a little bit of the ground that you covered with Tracy, it's our understanding that Robin Swan in his paper to you today suggested that these restrictions may well have to go on to just after Easter. Can you confirm that that is what was in his paper, and was serious discussion given to that, and how likely, I know you don't want to be committed at the moment, but how likely is that, because people want certainty, that that will be what happens?
We understand the fact that people want certainty, and I can confirm that in the executive discussion and the executive proposal from Health, that it said that we would have to revisit this again, that it may well be the case that you would have to extend. But there are many factors that will be taken into account. The increase in the new variant, the fact that it spreads faster, the current R rate at that time, the pressure on our hospital system. So we've committed in our own regulations to say that we continually keep these things under review on a periodic basis, and that's what we will continue to do. In the executive paper, it just talks about the possibility that yet a further extension may be required, but that we will review that again, obviously, at the next stage in post, which is on the 18th of February.
No, none of this is inevitable, Gareth. I think that I've said that many, many times. And of course, it is the duty of the Health Minister to say to us that we will look at this again on the 18th of February, review where we are then, look at all of the different variables, as Michelle has said. I think that's important to do. But what we're asking people to do is to work with us so that we can protect our hospitals, our staff, and of course cut down on the number of people who have to go to hospital and who unfortunately in some cases pass away as a result of COVID-19. So it's important that we all work together and we all look at what's in front of us. We have today said that these are in place now until the 5th of March, but we will review them on the 18th of February because it's important to do that.
Can I also ask you both about the announcement yesterday that military personnel would be deployed in a medical sense? Sinn Féin have chosen not to make a political issue of this, but can I ask you about remarks today by the Sinn Féin MLA Pat Sheehan at the Health Committee? He said, "I have no intention of making a row about this," but he said these soldiers coming in were of no concern to him. But his main concern was that they don't get in the way of real professionals. He described it as like slamming the dead cat down on the table to deflect attention away from inadequacies in the health department. Can I ask both of you if those remarks are helpful?
Well, firstly, let me say that the Health Minister has made the request for staff and support from the Military of Defence, and for my part, you know, and for Sinn Féin's part, our priority has always been to save lives, take the pressure off the health service, and we would never rule out anything that actually supports the health service. So there's no doubt, as I said, we're probably in the worst week this week in terms of the health service pressures to date, and you know, very much mindful of the pressure that all those staff are under and have been under for the best part of a year. In terms of disruption to service, I mean, that's the job of the Health Minister, it's the job of the Chief Nursing Officer, and also the job of the Trust to make sure that there's continuity of support and services in our hospitals. I've been in executive meeting all day, Gareth, so I have no. I haven't saw what Pat Sheehan said or what anybody else has said in committee. I just told you that that's the Sinn Féin position.
Well, I think it's very important to say that it is good that we can call upon this resource when it is necessary. The Health Minister has felt in order to make sure that he has safe staffing levels, that there's a necessity for him to call on this resource. Of course, these people will be as professional as the next medical person, and I think it's wrong to try and impugn that they won't have that professionalism, because of course they will, because they do this job, some of them in civilian life, some of them who are full-time military have chosen to do their medical training through the military, and of course that's to the highest standard.
Have you considered or have you been advised by health officials to introduce tighter restrictions over the next couple of months just to make sure that the numbers do go down by the 5th of March?
We haven't been advised of any, there's no ask from Health, for example, to bring in any further restrictions. I actually asked that question directly of the Health Minister at last week's executive meeting. Is there more that we can be doing at this moment in time? I think whenever you look at the pattern, obviously we have a decrease in the number of positive cases, which shows that the current restrictions are working. But as we always know, there's a lag period in terms of positive cases and then the implications for our hospital system, and that's what we're going through right now. So at that time, there was no ask or Health didn't feel that there was any need to bring in any further restrictions.
And then also, how much has the UK variant had an impact on your decision to extend the restrictions?
Well, I don't think it's just the variant that came from Kent. It's also the Brazilian variant we're worried about. We're concerned about the South African variant. There will be a number of variants because all of these viruses, and I'm certainly not a virologist, but we're told they do mutate. And what we want to be assured of is that the vaccine is able to cope with those changes, because we have great hope in the vaccine and we want to make sure that it works. We want to make sure that we stay ahead in relation to rolling out of the vaccine. Very proud of the fact that Northern Ireland is leading the way across the UK in relation to the rollout of the vaccine. And as I said, we're hoping to move now to the over 75 cohort next week. And I think that that will give a lot of hope to everybody. So it is important that we keep ahead on the vaccine, but as well as that, to remember that even if you are vaccinated, you can still carry the virus to other people, and therefore all of the other matters around social distancing will still continue, and I think it's important to say that as well.
Am I right in detecting that you are 100% in agreement on these measures? And if that is the case, can I ask you about another subject? Are the pair of you 100% in agreement that the British government and not the Northern Ireland Executive through its block grant should carry the cost, the ongoing cost of the pensions and the payments for victims of the Troubles? Thank you.
Well, Tommy, we are very much at one in the Executive today in relation to what needs to happen, and I think we had a very good discussion today around what's coming in the future and what we need to do as an Executive, not least about helping businesses to survive what is going on at the moment and then to recover after that. And we are going to be setting out a pathway around all of that in the coming weeks. I think it's important that we don't just give hope around the vaccine, but give hope to our business community as well. In terms of the victims' pension payment, let's be very clear, there is a legal requirement on us as an Executive to pay that, and therefore we will meet that legal requirement when the scheme opens, and we hope the scheme will open in March. There is a discussion between ourselves and the UK Government about the funding of that, but I just want to say to all of the victims that may be listening to us tonight not to concern themselves around that. We have a legal duty. We recognise that legal duty. Now it is up to us to make sure that the funding is in place from the appropriate source to deal with that.
So yes, in terms of the restrictions and the extension of the restrictions, the Executive is absolutely at one. There was no dissension to the discussions that we had today and the necessary measures which we've had to bring forward. And also in terms of the victims' pension payment, there's an agreement that that must be paid, and I believe it must be paid to all victims. I regret the fact that victims again have been used this week, and I believe some of the commentary from the British Secretary of State has been really unhelpful in that regard. In terms of the payment of the scheme itself, the British Government committed to this pension, and therefore they must also support the Executive in being able to pay for the pension, because the Executive doesn't have the ability to pay for it all by itself. So we make that case, and both myself and Arlene, as the Joint First Minister, the Justice Minister and the Minister for Finance have repeatedly requested meetings with the British Government to discuss this, and that's where those discussions should be had. The victims shouldn't be traumatised all the time in terms of the issues around the payment of the pension itself. We are all committed to paying the pension.
Just in relation to the first part of the question, do you both accept that you're at a very, very challenging place now? The military coming in, seems to be agreement on that, and one doesn't move to that situation unless you're in a very, very stark situation.
Yeah, I think we recognise, and we've been aware that this was going to be the week where we reached our peak, Tommy, for some time now, thanks to the modelling that takes place. And we recognise the absolute horrendous pressure that our staff are under in not just our hospitals, but also our domiciliary care workers who are out in the community visiting people who they need to care for. So we do want to say to all of them that we recognise that, and that we are working to try and support them. But in order to do that, the Health Minister has felt the need to call in some assistance, and as I say, I'm very grateful that we can do that because as professionals they will be able to give us that assistance.
This is the toughest week for the health service since the start of the pandemic, and all of our healthcare workers are stretched to the limit. They have been working day and night for the best part of a year now to support all of us and any of us that ever need the health service, and we can't thank them enough for that. But they have to keep going, and so do we. So in terms of our message today again to the public, it's to stick with the restrictions, to please stay at home and limit your movements. That's the best defence that we have right now, and that's the best thing that we can all do to support our health service right now.
In the few minutes since I tweeted that the restrictions had been extended, I've been bombarded with the same question from parents about education. Now, I've heard you say that the Education Minister will bring a paper next week, but can you give parents and schools any indication tonight about what the likely direction of travel is, or at least when they will know what the decision is?
Well, I think it's important to say, David, we all have clarity up until the mid-term break in the middle of February around the schooling of our young people. I'm certainly on record as saying that's not an ideal situation, but we recognise that we're in this situation because of the spread of coronavirus, and therefore we have to protect all in the community, including our young people, their families, and of course everybody that works in our schools. We do recognise that there are some teachers and some carers in schools, namely our special schools, and we had a discussion today around how we can try and support them, and in particular around vaccine priority. And we know that vaccine priority is set by the JCVI, but is there a role in terms of the fact that these are frontline workers and the fact that they're caring very much for our young people in special schools? Is there something we can do around that? So we are looking at that, and we're very alert to that. So we do have clarity up until mid-February, and we will of course discuss whether there is a need to extend that over the coming days. So parents will have plenty of time to have clarity, and indeed so will the schools.
And can I also just ask about the fact that Nicola Sturgeon on Tuesday announced an extension. You're announcing one today. How much collaboration is there these days between the governments in the four parts of the UK, and indeed between the devolved government here and the government in the Republic of Ireland?
I think there's very strong engagement across the board. We have regular conversations, both ourselves with a meeting that Michael Gove chairs once a week, so that's Scotland, Wales and ourselves, where we come together and just share current positions. Maybe just if there's ways in which we can share information or learn from each other, then that's what happens. There's regular engagement north-south also in terms of both at ministerial level, but then also at head of government in the executive and the Taoiseach level. There's also ongoing engagement with CMOs on an ongoing basis, north and south. So I think all those engagements, none of us have ever been here before, so I think that where we can share experience and work together, then that's where we should be.
So I think the collaboration has been really, really good. Yesterday we were sharing experiences around testing and how mass testing was able to provide some answers and some experiences across the UK. So Liverpool, Merthyr Tydfil, how those worked, how in Scotland they took smaller towns and villages and used testing there. So all of that learning is really good, really useful, because none of us have been in this situation before. So it is important that we share, and we are doing that, and I think that's to the benefit of us all when we do that.
Good afternoon, Ministers. In terms of retail, you had the meeting with the retail heads last week, and it seems that nothing really has changed since then. Are you going to bring in any extra measures or powers or laws to make sure that they aren't selling those non-essential items, or are they going to continue to be allowed to sell these throughout maybe the next 2 months?
So we did have a very good engagement with the retail sector and those representatives from right across industry, and it was a very robust conversation, but one where we had a very frank conversation just around some of the things that you have identified yourself. I think when it comes to this, what we're asking of the retail sector is to comply, is to work with the restrictions that are in place. We think it's very unfair that smaller businesses aren't able to sell products that larger businesses are, and this pandemic is unfair. It's unfair on many fronts. It's unfair and disproportionately impacting on women, on those on lower income brackets. There's nothing in a pandemic that is fair, but in terms of what we can do, we're working with councils, for example, around COVID enforcement officers. We're working with the PSNI around enforcement. and we'll use whatever tools that we have to try to limit the practices which you have rightly identified. But we will not be found wanting in terms of engaging directly with these people and actually putting the case to them. And also the other thing that I would say is that sometimes the forgotten heroes throughout the pandemic have been those people who've been working in our shops, people who have been stacking the shelves, people who've been working at tills, people who've been having to be available to provide essential food for people the whole way through this pandemic. And I don't know if we say thank you enough to them. So today I would say thank you to the shop workers for everything that you've done throughout the pandemic as well.
And we all know this lockdown has been very difficult in terms of mental health on everyone, in fact, right across the country. Has the Executive had any discussions about what extra services or maybe extra funding can be put in place for those mental health services?
So mental health is a recurring theme at our executive meetings, because I think we're all alert to the fact that asking people to be isolated from their normal support structures, whether that's family or friends, is a real challenge. And so we've asked on many occasions for people to reach out to their friends and neighbours remotely, either by telephone or indeed using Zoom or whatever, so that they can stay in touch. But the Health Minister is very alert to the mental health issue as well, and I think post this it'll not just be the health workers where we do have a concern about post-traumatic stress, but actually the community in general who are suffering in relation to mental health. And it's not just the statutory bodies that support mental health. There are many community mental health facilities there, and of course they can still provide face-to-face help. It's one of the exceptions to the restrictions. And I would just make a plea to anybody today who is feeling that they're overwhelmed and they can't cope. Please seek help. The help is there. Yes, I know the restrictions are in place, but help is there, and please seek that help if you're in a bad way. Thank you.
Thank you.